Today we're going to talk about the shoulder girdle and the shoulder joint complex, how to stabilize and move. First of all, I'm going to talk to you about the shoulder girdle. The shoulder girdle is also known as the scapulothoracic joint, and it is important for stabilizing. The stabilizing muscles of the shoulder girdle are effective for the postural alignment of the body. They're important for the overall functionality and movement throughout the day. Stabilizing muscles of the shoulder girdle include the trapezius, levator scapulae, rhomboid, subclavicus, and pectoralis minor. And when we work on the stabilization, it is equivalent to less movement and more functionality. Before we begin the exercise, it's important to note that we want to work on the stabilizing muscles of the segmental system before we move on to the global muscles of the phasic system.
So now we're going to talk about the shoulder joint, also known as the glenohumeral joint. This joint is classified with the ball and socket joint. So saying that, we have a lot of mobility, we have a wide range of motion, and in order to have that, we sacrifice stability. So we can stabilize this by targeting the glenohumeral ligaments, and this can be accomplished by strengthening the sits muscles or the rotator cuff muscles, which are the supraspinatus, we have the infraspinatus, the teres minor, and the subscapularis. And it's just really important to know that we do sacrifice stability for mobility for this joint.
So the first exercise we're going to talk about is how to stabilize the shoulder girdle. So what we're going to get you to do is the external dumbbell rotation. You're going to start by lying on your side and prop yourself up on your elbow and place your head on top. Don't want to sacrifice posture to an exercise. You're going to place your elbow on your hip just like this. Bring the hips forward and make sure they're not falling backward because you won't target the muscles in the scapula. It's important to note that in this phase of the exercise, we have elbow flexion and it is held in an isometric contraction. We're going to begin the exercise by retracting the scapulas together, and you're going to hold that in isometric contraction throughout the exercise. You're going to want small movements forward and back, just like this. You want to start with a light weight, as it could be kind of heavy and hard for your scapula to work. Keeping that isometric contraction of the retraction of the scapula, we are going to work in the concentric phase when we lift up. So we're working the infraspinatus, posterior deltoid, teres minor, rhomboids, and the middle trapezius. Important to note that if you are standing up to perform this exercise, the concentric phase would be both ways. You're working in an open kinetic chain as you are free to move, and we're working in the transverse plane, longitudinal axis. The next exercise we're going to work on is how to stabilize the shoulder joint itself. So it's important to note that we want to target the rotator muscles of the shoulder to stabilize the shoulder joint. The exercise I'm going to do for you today is called the downward facing dog. So it is part of the yoga vinyas, one of my favorite. Stabilizing exercises for the shoulder joint are to stabilize those muscles to hold the humeral head into the glenoid cavity. So the exercise will look like this. I want you to start on your hands and knees, bringing your arms forward. You're going to have elbow extension and wrist extension. You have shoulder flexion. Then we're going to work on straightening your legs. Don't straighten them all the way just yet. Kind of work into that pose. And then when you're ready, straighten the legs out. Now when you straighten the legs out, you're going to have knee extension and hip flexion. We're working in a closed kinetic chain because we're working against the resistance of the ground. When you do this exercise, you're working all the rotator cuff muscles, so the sits, the subscapularis, infraspinatus, teres minor, and supraspinatus. As well, we are working in an isometric contraction when we hold the pose. Important to note that we're working in the sagittal plane, meaning that we have a medial lateral axis of rotation.
So I'm going to show you how to do a bent over shoulder row, and this is working the shoulder girdle muscles. We're working the mover or global muscles for this exercise. So you can either do it standing up and bent over like so, or you can do it on a bench. I'm going to show you on a bench. So you'll lean over like this. You'll have your hand pronated grip on the dumbbell. You'll lean over, and it's important to keep your spine neutral, which is your erector spinae working there to prevent injury. So you'll lean over, you'll have your arm in extension and your shoulder and a little bit of flexion. So you're going to pull up, doing elbow flexion, using your bicep muscles. Then you're going to retract your scapula and do extension of the shoulder, brought to you by your rhomboid major and minor and your middle and lower trapezius. And the latissimus dorsi is what extends the shoulder back in that. So the concentric phase is when you're pulling it up and retracting your scapula back. This is an open kinetic chain because you are able to move your hand free in space. You're moving in the sagittal plane along the medial lateral axis. So I'm going to tell you about working the mover muscles of the shoulder joint with our proper posture to prevent injury, and make sure that the dumbbell, we're holding it with a pronated grip and it's down by our sides. We have elbow extension brought to you by your triceps, and you need to make sure that you keep that extension throughout the entire exercise. So you start out and you slowly do shoulder flexion, brought to you by your middle and anterior portions of your deltoid and your pectoralis major, more specifically the clavicular fibers, as well as a little bit of your coracobrachialis. So the concentric phase is when you're lifting that dumbbell up, and then you can isometrically hold it there. And again, you're moving the sagittal plane along the medial lateral axis. This is also an open kinetic chain because I am free to move my arm in space.